Hello, my name is Colleen Kissel, and I am the founder of the Pediatric Oncology Treasure Chest Foundation. Seated with me, I am with Jennifer Torres and her lovely daughter, Mariah. And Mariah, how old are you?
7.
Okay, you're 7 years old. I understand that you were diagnosed with leukemia at the age of 6 years old. What was going on when your daughter was diagnosed?
Absolutely. We brought her into the emergency room. They did all kinds of tests and could not figure out what was wrong with her. By day 5, she still had fevers of 105. And basically, at that point, they did a bone marrow test. And that afternoon, on a Friday, they confirmed that she did have leukemia, or it's actually acute lymphoblastic leukemia, which is one of the main types. And then there's also subtypes as well. And I just bursted out crying. The first thing I asked was, is she going to die? Because people who don't know about cancer think right away, you hear cancer, you hear about death, and that's the most scariest thing that you could ever think of, possibly, with your child. So she's a little bit over a year into treatment now. So basically, in the beginning, it started off at 1 week. Every week we would go for chemo, and she would also take pills and things like that, during the day and the weekend as well. As she's gotten a little better, she's now in maintenance phase, so she's actually going to the clinic twice a month, and is also getting spinals, which is basically chemo through her spine, and also through her port every 4 months now. So it's gotten a lot better, I have to say.
Yes, the beginning's dreadful.
It sure is.
There was this 21-day span where Martin developed these mouth and throat sores, and he was on a feeding machine, and he was hospitalized for, I want to say, about 7 days. He couldn't eat. And I'm telling you, I thought, this is it, we're at the end. But he recovered, and did you guys ever experience any dreadful setbacks like that?
Yes, we actually had one day in particular, 1 week, where she had those sores as well. I think it's kind of a common thing with the chemo and not wanting, little children not wanting to brush their teeth all the time because they're in the hospital, and their mouth is sore, whatever the case may be. Sometimes things get worse in there. She did get to the point where she's in the hospital for 2 weeks and couldn't eat, and was getting fed by, the bags, by the, IV and all that stuff. So, yeah, that was definitely one of the darkest days, in addition to, obviously, the day that we found out she was sick, thinking that something, wasn't seriously wrong when it was.
And, they say there's a fine line. If you don't give enough chemotherapy, the patient won't be cured. And if you give too much, you end up, with the mouth sores and,
other issues.
So, but I feel in the long run it paid off. But yeah, that was one of my darkest days also. And so if there is a good side, maybe going to the clinic, or what is one of the best things about going to the clinic or the hospital?
Honestly, the Treasure Chest Foundation is one of the best things that has happened to us.
Well, thank you. The reason I've asked you both to come here was to help get the word out about how valuable the Treasure Chest Foundation is.
On days that Mariah is at a regular clinic visit, just to visit or to check her blood or whatever the case may be, there is the treasure chest that she's allowed to go into and pick out a small toy. And then if she has a long day of chemo or whatever the case may be, blood transfusions or whatever, she's able to go into the toy closet, which is a larger toy. And that's something that she looks forward to in both aspects.
Can you tell me about the treasure chest at Hope Hospital?
Well, I like going to treasure chest because there's a lot of the toys in there, and I like the toy chest because I get to pick toys out after I don't feel well, even if I don't get a bone marrow or spinal tap.
You make me almost want to cry because you shouldn't have to go through any of that. But at least you get a little bit of a prize,
Something
right?
to look forward to, yeah.
We don't turn down any siblings if they are there. Most of them are probably in school, but if a little one comes with, we don't turn them down because the whole family goes through or is suffering.
We appreciate that as well.
What would you say to the contributors, the men and women and the Girl Scouts and the Boy Scouts, the people that open that door all day long bringing toys in for the little ones?
What can we not say? We're so grateful for everything that they do for us. It's something that we really appreciate, and not only us but our families and also the other children that are going through it. I'm sure they appreciate it just as much. But as a family, speaking for everybody, I have to say we we are so grateful for everything that they do for us.
What has been one of your favorite toys from the treasure chest or the closet?
The drawing set that I got from the closet.
The drawing set? Okay. And are you an artist? Do you like to color or draw? Good, good. I bet that helps out when you're sitting there all day long.
Gives her something to do.
Yes, exactly. Okay, what would you like to say to all the people who bring the toys?
Thank you for bringing all the toys for the sick kids, and it really makes us happy to look forward for something at the end of the day after we go to the clinic.
Oh, Mariah, that is beautiful. Thank you very much, and you can go back and pick out something to take home, okay?
Thank you very much.
All right, well, thank you, okay.